Now, one of the keys to coping with COVID-19 is, well, it makes a lot of sense, doesn't it, to be as healthy as possible. Doctors are looking for a vaccine, but while they're doing that, there's a sensible call for us to all have a balanced lifestyle. Well, let's talk to cardiologist Dr. Aseem Malhotra. Good to see you this morning,
Hi, good
Aseem.
morning.
I mean, we know, obviously, that people most at risk have got compromised immune systems. What do we therefore do to boost, to bolster our immune systems?
Steve, I think the first thing to say before we talk about that, I think it's really important, as you've continuously reiterated on Sky News, people must maintain social distancing. So that means I think we all have to behave like we've got the virus, whether we're asymptomatic, we've got some symptoms, and keep away from people as much as possible. If you have to go out, and we'll talk about that in a second, then maintain a 2-meter distance from the person that you're with. Now, the elephant in the room, Steve, and all of this, which hasn't been discussed so far, is the people who are most vulnerable to severe complications from this virus have chronic metabolic disease. So I've looked at this data quite extensively. If you look at Italy, the average age of death, of course, was older population, 81. They have the oldest population in Europe, yes, but the average person who died had at least 2.7 chronic conditions, which included high blood pressure, type 2 diabetes, smoking, and cancer. In Wuhan, more than 60% of the people who suffered major complications, and tragically many of these people died, had type 2 diabetes or high blood pressure. Now, the reason I talk about the elephant in the room, Steve, is that the general health, unfortunately, of the British, American, and many European people is dire. We have 6 out of 10 adults overweight or obese in this country, similar in America. Only 17.4% of people in the United States are metabolically healthy. Now, why is that important? Well, first and foremost, if you have high blood glucose, if you're pre-diabetic or type 2 diabetic, then you have a dysregulated immune system. Your white cells cannot function optimally. The same applies to people who are overweight or obese as well. We know people who with obesity suffer more complications from influenza. So I think this is a really important message that people need to get across. Now, it's not all doom and gloom, because as you started, in the intro, you said that we can do things from a lifestyle perspective. Well, lifestyle changes, Steve, can actually have an impact on people's health within weeks to months. We know type 2 diabetes, for example, can be put into remission, up to 50% of cases within months of changing lifestyle. So all these things need to be thought about. Now, what would I advise? What am I advising my patients? What am I advising the public to do about this? Well, first and foremost, the problem with obesity and excess body fat is really related to ultra-processed food. Half of the diet in Britain is ultra-processed food. We need to curb that considerably. A lot of people are going to be at home now. This is a great opportunity to think about spending more time cooking nutritious foods. Think about what you eat is going to impact your immune system. And the likelihood, Steve, is that we are probably all at some point going to get this virus. The question is, are we going to have mild symptoms or more severe symptoms? If we look after our health properly now, we can protect ourselves from severe illness. So eating nutritious whole foods, cutting the ultra-processed foods, the snacks, the crisps, the chocolates, all that to a bare minimum. If we can do that, we're already on a good way to better health. Being active. Now, a lot of people are going to have to stay at home. I understand that. CrossFit Health have a website, a free website, where people can go online and look at home exercises. Physical inactivity is a major problem. William Bird, there's an article today in the Sunday Express, a news story. William Bird, who's an advisor to the World Health Organization on physical inactivity, has estimated that just from 3 months of being inactive, extra 3 months, in addition to the inactivity we already had, could result in an extra 7,000 deaths in the next 1 year in the UK. So what can we do about that? Simple things. Going out for brisk walks for 10 minutes, a couple of times a day, can boost the immune system. Really important. Some strength training at home. You can do home exercise. So I really stress that very importantly. The other thing is sleep. We need to try and ensure, I know it's difficult, people are very stressed right now. We need to try and ensure that we can get at least 7 to 8 hours of sleep. Now, one quick anecdote, many years ago, working as a junior doctor, working very busy shifts, I suffered the worst bout of flu I can ever imagine. And what happened leading up to that was 3 things. One is I was very stressed. I wasn't sleeping. I was snacking on junk foods. And then to make the situation worse, I then overtrained. I over-exercised. I ran for an hour at high intensity. Actually, what many people don't realize, if you over-exercise, you do too much, it depresses the immune system for at least 24 hours. So let's just think about this carefully. And of course, let's do what we can to reduce our stress levels. It means connecting with family members, even if it's via Skype or on the phone, doing things that we can try and enjoy doing in the household, but also getting out and getting some fresh air. If we do all of this, Steve, it's not just an opportunity for us to help save many lives from the coronavirus, but moving forward, we will get through this. We will get through this. Our healthcare system will be in a much better place in a year or two from now, because one of the reasons we're not coping with this crisis is because of these chronic metabolic diseases related to lifestyle over the last couple of decades that have increased, have meant that our healthcare systems were already overstretched. We've now got the coronavirus involved. This is a complete public health crisis, as you know.
Look, I mean, to be honest, a lot of that sounds like common sense, you know, eating more fruit and veg, you know, cooking stuff from scratch. And as you say, a lot of people are going to have more time to do that now. So it's a good time to be getting into that habit. But you started off talking about metabolic health and poor rates of metabolic health. What does that actually mean?
Well, metabolic health, essentially, Steve, in simple terms, is basically lifestyle, things that we do as part of our lifestyle that have adverse effects on conditions related to excess body fat. So high blood pressure, probably about 50% of high blood pressure is related to excess body fat. Type 2 diabetes is a condition of, you know, I would call it ultra-processed food disease, really. Too many refined carbohydrates and sugar in particular, unhealthy fats, these contribute to that. And of course, heart disease, cardiovascular disease, which is obviously my area of expertise, is related to these conditions or risk factors. Smoking, let's not forget smoking. There's still a relatively high prevalence of smoking. It's come down dramatically in this country over the last few decades. But if you smoke, then you're much more likely to have complications from respiratory viruses. So this is the best time than ever. There's no better time than now to stop smoking as well. So if you combine all these conditions with obesity, then these are what we call the chronic metabolic diseases. And also, I know it's, you know, a lot of people can't do much about this now, but moving forward, we think there is a very strong evidence to suggest that these chronic conditions relate to, you know, poor lifestyle choices also are a big contributing factor to development of cancer too.
Okay, Asim, as always, good to talk to you. Thank you.
Thank you.